If you've ever quietly wondered, are my testicles normal sized? You are definitely not alone. Let's unpack the facts behind testicle size, what changes are normal, and when a difference might point to something more serious. Hi, I'm Dr. Camilla, host of the Intimacy Lab here at UB Health. As one of the AI faces of UB's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around sex, sexual health, relationships, and intimacy. With so much misinformation floating around online, it's more important than ever to get doctor approved info you can actually trust. So, testicle size. Not exactly a dinner table topic, but definitely one that stirs up a lot of curiosity and insecurity. Let's start with a baseline. The average testicular volume in adults falls around 18 to 20 cubic centimeters. If you're more of a visual learner, that's about the size of a large grape or maybe a small plum, roughly 1.5 to 2 inches long and about an inch wide. Most people fall somewhere along that spectrum, but there's a naturally wide range. Now, here's where things get interesting. Testicle size isn't static. Like the rest of your body, your testicles go through changes over time. They typically reach adult size by age 20. After that, they stay relatively stable until later in life. It's common, and completely normal, for testicles to slightly shrink with age, especially after 50, as testosterone gradually declines. But what about if your testicles feel smaller than average, or if one seems significantly smaller than the other? A few possibilities to consider. One common cause of underdeveloped testicles is a condition called Klinefelter syndrome, where someone has two X chromosomes and one Y, rather than the usual one X and one Y. This affects about 1 in 600 people with testes and often goes undiagnosed. It's also one of the more frequent genetic contributors to fertility issues. Outside of genetics, certain medications can contribute to testicular shrinkage. Anabolic steroid use, testosterone therapy, and even some cancer treatments can impact testicular volume. And yes, trauma to the area, including injuries from sports or infections like mumps, can cause one or both testicles to shrink. If you've noticed a recent change in size, or you're dealing with swelling, pain, or a significant difference in testicle size, it's always worth checking with a doctor. Infections, varicocele, those swollen veins in the scrotum, and even testicular cancer often show up as changes in size or texture. Okay, let's shift gears for a second and talk usability, not just biology. Bigger doesn't mean better. From a function-first perspective, what matters more is what's going on inside. Most of a testicle's volume is dedicated to something called seminiferous tubules, tiny coiled tubes that help produce sperm. So yes, very small testicles may correspond with lower fertility, but the relationship isn't one-to-one. Plenty of folks with smaller than average testicles have no trouble conceiving. For those who are more concerned about aesthetics, there are actually procedures, like testicular implants, that can alter the visible size of the scrotum, similar to breast implants. It's a deeply personal choice, and from what I've seen, the motivation often isn't just physical, it's emotional. Feeling more confident in your body matters, no matter your gender. That said, there are non-surgical ways to support testicular health. Here are a few. Avoid high temperatures. Hot tubs, saunas, and tight underwear can temporarily lower sperm production and even affect testicular function. Keep an eye on steroid or testosterone use. Any hormone-altering medication should be monitored by a medical professional. Maintain a healthy lifestyle. Regular exercise, balanced diet, reducing alcohol, and managing stress can all support reproductive health. And if you've been dealing with discomfort, swelling, or just a nagging feeling that something's off, don't ignore it. Your body's trying to tell you something. Worried about your own health? Start by checking in with the UBI Symptom Checker at ubhealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And don't forget to like and follow for more doctor-approved info you can trust from UBI Health.